Okay, thank you very much for the opportunity to present on the result of this work. I'll be actually presenting on behalf of my colleague that could not be here in Australia. And so the title of this study is the characterization of HIV-1 reservoir in children, adolescents, a systematic review and meta-analysis towards pediatric HIV cure. So as an introduction, it should be noted that during the recent year, there has been an unprecedented success in the control of virological replication among HIV-infected people. And we know that this is due to the availability of modern antiretroviral therapy, which is actually effective and safe. And unfortunately, antiretroviral treatment requires lifelong administration, and there is still no cure. And as we know, even after having achieved virological suppression for a very long period, when the patient gets off treatment, there is a rebound of the viruses due to the reservoir. And so reservoir can be classified actually as anatomical, cellular, or molecular. But it's important to say that a lot of efforts have been made during the recent years in terms of diagnosis and treatment. But it is also important to note that effective interventions that actually target the implementation, right, should be actually used to overcome the limitation of antiretroviral treatment. And significant progress has been made in the understanding of HIV viral reservoir, but we know that very little is still known, especially among children and adolescents. And that's actually why experts recommended in 2021 that it's important to characterize the establishment, persistence, and potential for preventing HIV latency in children which are under antiretroviral treatment. So the objective of this work was to evaluate the HIV DNA profile among pediatric populations, and more specifically, we evaluated the factors associated with HIV DNA size. And secondly, we characterized the genotypic profile, that's the archive drug resistance mutations in the HIV DNA among children and adolescents. So as methods, we actually performed a systematic review and meta-analysis using the PRISMA guidelines. The keywords were input into the major database. And we actually included clinical trials, both randomized and non-randomized cohort studies, and cross-sectional studies by actually excluding reviews, comments, and case reports. As I already said, the participants actually included were children and adolescents aged from 0 to 19 years. And we use R for the analysis. Looking at the result, after the identification of the various papers that we found, we actually excluded some due to duplicates, and we assessed for eligibility a total number of 121 studies, but we further excluded some studies following our exclusion criteria, and we end up with a number of 49 studies that we actually used for systematic review and meta-analysis. Looking at the 49 studies, majority of them were cohort studies, and the total sample size that was actually concerned in this study was 2,356 participants. As we can see on the map, the countries that were represented were 17, and we can also see on the map that data from sub-Saharan Africa was really limited. So looking at the total HIV DNA according to age at ART initiation, even though we did not find any significant difference between infants and adolescents, it should be, however, noted that the HIV reservoir size was smaller in those starting ART within 2 months compared to those who started actually treatment later on. And of course, the early treatment reduces, from this observation, it actually confirms other data that demonstrated that early treatment reduces HIV viral reservoir. Looking at the total HIV DNA, according to the viral suppression duration, we have actually noted a negative and significant correlation between total HIV DNA and viral suppression duration. And that is the size of HIV DNA significantly decreased with the increase of viral suppression duration. And when we went further to stratify actually this viral duration into 2 categories, that's less than 5 years and more than 5 years, we have actually seen that a significant low level of HIV DNA was observed in those that were suppressed for more than 5 years. Looking at the total HIV DNA, this time, according to the CD40 cells percentage categories, we noted that a higher HIV-1 DNA level was associated actually with low pre-therapy and contextual TCD4 percentage. Also, children starting ART with high pre-therapy viral load actually showed a high level of HIV, total HIV DNA. And this actually implies that early initiation and strategies to achieve early virological control and sustain viral control should be reinforced, as we just saw in the previous presentation. One of the strategies could be, for example, the rapid transition to dolutegravir, and also the fact that support for the long-term for the long-term adherence should be actually reinforced in those children. And looking at the meta-analysis, we found that the pool archive drug resistance prevalence was high. It was about 38%. And this prevalence was even higher in the studies that were conducted in sub-Saharan Africa. And looking at the burden according to geographical distribution, here again we can see that high burden was observed in sub-Saharan Africa, close to 50%. And this could be probably mainly due to the previous extensive use of low genetic barrier drug, such as NNRTI and suboptimal adherence also. Finally, looking at the specific archive drug resistance mutation, we actually, as we can see in the table, genotyping was actually performed generally in 3 compartments: PBMC, whole blood, or Boficot, and the technology that we used was mainly Sanger or next generation sequencing. And as it was expected, the most prevalent mutations were those that were selected by NNRTIs. This is, of course, due to their low genetic barrier to resistance. It's important to note that the factors that were associated with the presence of archive drug resistance mutation in the studies that were included were WHO clinical stage 3 and 4, poor adherence, virological failure, or rebound, and high viral loads. So in conclusion, what can we say from this study? The first thing is that in children and adolescents, high level of HIV DNA was associated with delayed ART initiation, shorter duration of viral suppression, and immunovirological status, since we actually saw that those who had low level of CD4 and those who had actually also a high level of pre-therapy viremia was actually significantly associated with having a significant size of the HIV DNA. The second thing is that there is a high level of archive drug resistance mutation in proviral HIV DNA among children and adolescents, especially in sub-Saharan Africa. And the factors that were associated with the presence of archive drug resistance mutations, as we saw, was WHO clinical stage, poor ART adherence, and virological status. So from these 3 points, we can actually conclude by saying that we think that to achieve the pediatric HIV cure, strategies that actually ensure early ART initiation and long-term virological suppression maintenance should be also a priority. Thank you for your kind attention.